Your skin has been trying to tell you something. Not in the vague, metaphorical way that wellness content talks about the body sending messages. In a direct, specific, visually readable way that dermatologists and endocrinologists recognize immediately when they see it, because they know what it means, where it comes from, and what is happening in the bloodstream of the person standing in front of them when certain patterns appear on the skin. The problem is that most people over 60 who are carrying these patterns have never had someone sit down and explain what they are, why they appear, and what the blood sugar story behind them is. They have attributed them to aging, to dry skin, to sun damage, to the kind of cosmetic changes that happen to skin after decades of living in it. And while they were looking in the mirror and accepting these changes as the ordinary price of getting older, the underlying metabolic condition creating them was quietly advancing, damaging blood vessels, straining the kidneys, accelerating nerve deterioration, and building toward the cardiovascular complications that most people understand as diabetes consequences, but that can be prevented or significantly slowed when the metabolic disruption is identified and addressed early. The skin is the largest organ in the human body, and it is the only organ you can examine without a scan, without a blood draw, and without a medical appointment. It is in direct, constant contact with the circulatory and metabolic environment of the body's interior, and when that environment changes in specific ways, the changes show up in specific, readable patterns on the skin's surface. The patterns associated with blood sugar dysregulation are not subtle, and they are not rare. They are present on the bodies of millions of people who do not yet have a diabetes diagnosis, who may not even be in the prediabetes range on their most recent blood work, but who are carrying enough metabolic disruption to be creating the dermatological signatures that trained eyes recognize as early metabolic warning signals. This is Dr. Victor Lang, and this channel was built for exactly this kind of conversation, the one where a visible, accessible signal gets properly decoded so that the people carrying it have the information to act before the underlying condition advances. If this is where you want real, mechanism-grounded health information, hit like and subscribe right now, because what follows is going to change how you look at your own skin. Let us start with the most common and the most frequently missed of all the blood sugar skin signals, because it is one that affects an enormous proportion of people with insulin resistance, and that is almost universally attributed to cosmetic or sun-related skin changes by the people who have it. It is called acanthosis nigricans, and it presents as darkened, velvety-feeling, slightly thickened skin that appears in the folds and creases of the body, the back of the neck, the armpits, the groin, the area under the breasts, the inner thighs, the creases of the elbows and knuckles. This darkening is not a surface stain or a sun damage pattern. It is a structural change in the skin itself, driven by a specific biological mechanism that is directly tied to insulin resistance. When insulin resistance is present and blood insulin levels are chronically elevated, excess insulin activates receptors on the skin cells in these body fold areas. Specifically, it activates insulin-like growth factor receptors that stimulate the proliferation of keratinocytes, the primary cells of the outer skin layer, and the melanocytes that produce pigment. The result is a thickening and darkening of the skin in the areas where these receptors are most concentrated, which happen to be the body folds where skin-on-skin contact is highest. This is not a cosmetic issue. It is a metabolic marker, a visible sign that insulin is chronically elevated in amounts high enough to drive abnormal cellular proliferation in the skin. Studies on acanthosis nigricans as a screening tool for insulin resistance and prediabetes have shown it to be a clinically useful predictor of metabolic dysregulation, with a strong association with elevated fasting insulin, impaired glucose tolerance, and the trajectory toward type 2 diabetes. In a primary care or dermatology setting, seeing acanthosis nigricans in an adult patient is supposed to trigger metabolic screening. In a bathroom mirror, seeing it and attributing it to a skin condition or to aging is a missed opportunity for intervention at exactly the stage when intervention has its greatest impact. The second blood sugar skin signal is one that appears on the lower legs and shins and that has a medical name that most people have never encountered despite carrying the condition for years. It is called diabetic dermopathy, or shin spots, and it presents as small, round, or oval, light brown, slightly scaly spots on the lower legs, typically between the knee and the ankle. In older adults, these spots are frequently attributed to age spots, sun damage, or the residue of healed minor injuries. They are none of those things. Diabetic dermopathy is the result of changes in the small blood vessels of the skin driven by chronically elevated blood sugar. Glucose in excess concentrations damages the microvasculature through several pathways, including glycation of vessel wall proteins, oxidative damage to endothelial cells, and the thickening of basement membranes surrounding the capillaries. When the capillaries in the skin of the lower legs are damaged by this process, minor injuries to the skin, pressure, friction, or small impacts that would be completely healed in metabolically healthy skin instead leave persistent pigmented spots because the healing microvasculature is impaired and the inflammatory cleanup process is incomplete. These spots are painless, they do not itch, they do not ulcerate, and they are extraordinarily easy to dismiss. But their presence on the lower legs of an adult over 60, particularly when they are multiple and bilateral, appearing on both legs, is a documented dermatological sign of microvascular damage from blood sugar dysregulation, often appearing years before a formal diabetes diagnosis is made. The third skin signal involves the fingers, and it is one that produces a physical sensation as well as a visual change, which makes it both more noticeable and more consistently dismissed as something unrelated to blood sugar. It is called digital sclerosis, or thick skin syndrome of the fingers, and it presents as a gradual thickening and tightening of the skin on the backs of the hands and fingers, sometimes extending to the forearms. People with this condition notice that their finger skin feels waxy or stiff, that the joints of the fingers feel less flexible when trying to press the palms flat together, and that the skin has a thickened, slightly shiny quality compared to what it once felt like. This stiffening is the result of glycation, a process by which sugar molecules attach to collagen proteins in the skin and cross-link them in abnormal configurations that reduce their flexibility and alter their structural properties. Collagen is the primary structural protein of the skin, and when it is glycated, the skin loses the pliability that healthy collagen provides. This same glycation process that is occurring visibly in the skin is occurring in the collagen of blood vessel walls, joint capsules, the lens of the eye, and the basement membranes of the kidneys throughout the body, which is why diabetic dermopathy in the skin is a marker for the much broader pattern of glycation-driven damage occurring simultaneously in tissues that cannot be seen from the outside. The fourth blood sugar skin signal is one that is particularly alarming when it is understood, because it involves a rash-like eruption that appears suddenly, and that most people receiving it have no framework to connect to their diet or their metabolic state. It is called eruptive xanthomatosis, and it presents as small, firm, yellowish or orange-tinted bumps that appear suddenly, often in clusters, on the buttocks, the thighs, the shoulders, or the backs of the arms. These bumps are deposits of triglycerides, blood fats, that have accumulated in the skin when blood triglyceride levels become extremely elevated, which happens in the context of poorly controlled blood sugar and significant insulin resistance. Insulin is normally required for the activation of lipoprotein lipase, the enzyme that clears triglycerides from the bloodstream. When insulin resistance is severe enough that this enzyme activation fails, triglycerides accumulate in the blood to extremely high levels, and the skin becomes a site of overflow deposit. Eruptive xanthomatosis is not subtle when it appears, but its connection to blood sugar is not something most people make intuitively, and the bumps may be treated topically or attributed to a skin condition for extended periods, while the metabolic emergency generating them goes unaddressed. The sudden appearance of yellowish waxy bumps on the body of an older adult is a signal that warrants immediate medical evaluation for blood sugar and lipid levels. The fifth skin signal is one that does not appear as a visible spot or bump, but as a change in the overall character of the skin that is easy to dismiss as simple dryness or aging. It is the profound itching and dryness that accompanies chronically elevated blood sugar, particularly on the lower legs, but sometimes throughout the entire body. When blood glucose is elevated, the kidneys work to eliminate excess glucose through the urine, producing a higher than normal urine volume that removes fluid from the body and can contribute to dehydration even in people who are drinking adequate water. This metabolic dehydration, combined with the direct effect of elevated glucose on the skin's sebaceous glands, which reduces normal oil production, and the neuropathic changes in the small nerve fibers of the skin that alter sensation, produces a chronic skin dryness and itching that is qualitatively different from ordinary dry skin. It is persistent. It is frequently worse at night. It does not fully respond to moisturizers, and it is most pronounced on the lower legs and shins, the same areas where the microvascular damage of diabetic dermopathy appears, because the skin in this area is most dependent on the small vessel blood supply that elevated blood sugar compromises first. Persistent itching on the lower legs in an adult over 60, particularly when it is accompanied by any of the other signals we have discussed, warrants blood sugar evaluation as part of the assessment. The sixth blood sugar skin signal involves the healing of wounds and skin injuries, and it is perhaps the most practically consequential on this list because it affects daily safety and quality of life in ways that go far beyond cosmetics. When blood sugar is chronically elevated, the cellular machinery of wound healing is impaired through multiple simultaneous mechanisms. Elevated glucose reduces the function of neutrophils, the immune cells responsible for clearing bacteria from a wound in the first phase of healing. It impairs the proliferative activity of fibroblasts, the cells responsible for producing the new collagen that closes a wound. It reduces the growth factor signaling that coordinates the stages of healing. And it compromises the microvascular blood flow that delivers the oxygen and nutrients that every stage of healing depends on. The result is that wounds that should heal in a week persist for 2 or 3 weeks. Minor abrasions that should close cleanly become prone to infection. Small cuts on the lower legs and feet, an area already compromised by poor microvascular supply, can become chronic non-healing wounds that develop into the serious diabetic ulcers that are among the primary causes of hospitalization and limb loss in people with uncontrolled blood sugar. Noticing that your skin heals more slowly than it used to, particularly on the lower extremities, is one of the most practically significant warning signals the blood sugar story can produce. The seventh skin signal is one of the most visually specific and diagnostically informative, and it appears in a location that most people examine closely every morning. It is called skin tags, medically known as acrocordons, and while skin tags in isolation are common and largely benign, a sudden increase in the number of skin tags, particularly in the body fold areas where acanthosis nigricans also appears, has a well-documented association with insulin resistance. The same insulin-driven overstimulation of growth factor receptors that causes the skin to thicken and darken in acanthosis, nigricans also stimulates the formation of small outgrowths of skin in these high-contact areas. Research on the relationship between skin tag count and insulin resistance has shown a statistically significant correlation between the presence of multiple skin tags and impaired glucose tolerance, elevated fasting insulin, and the metabolic syndrome cluster of cardiovascular risk factors. A few skin tags acquired over decades of adult life is unremarkable. A rapid increase in skin tag number, particularly in the neck, armpits, or groin, in an adult over 60, is a dermatological signal worth taking to a physician for metabolic evaluation. Now let us talk about what to do when one or more of these signals are present, because the skin is showing you something that has a timeline attached to it. The metabolic dysregulation that produces these skin changes is addressable, often dramatically so, with the right interventions applied before the process has advanced to the stage of clinical diabetes and its more serious complications. A fasting blood glucose, hemoglobin A1C, fasting insulin, and a lipid panel covering triglycerides together form the basic metabolic picture that tells you where you actually stand and where you are headed. These tests are straightforward, widely available, and often covered under preventive care in standard insurance plans. Requesting them at your next medical visit, with the specific framing of having noticed skin changes that you would like to have evaluated in the context of metabolic screening, is both entirely appropriate and entirely within your right as a patient who knows what to ask for. The dietary interventions that most powerfully address the insulin resistance driving these skin changes are the ones that reduce the post-meal blood sugar spikes that drive chronic insulin elevation. Reducing refined carbohydrates and added sugars reduces the glycemic load that the pancreas has to respond to with insulin. Increasing dietary fiber slows glucose absorption and blunts the post-meal insulin demand. Eating protein and fat before or alongside carbohydrates at meals reduces the speed of glucose entry into the bloodstream. Time-restricted eating patterns that shorten the daily feeding window have documented effects on insulin sensitivity in people with early metabolic dysregulation. And specific foods with documented insulin sensitizing effects, including apple cider vinegar before meals, cinnamon at 1 to 2 grams daily with food, berberine at doses used in clinical research, and magnesium supplementation addressing the deficiency that contributes to insulin resistance, all address the biochemistry of the problem from directions that complement each other. The skin changes that are reversible with metabolic correction will improve as insulin resistance is addressed. Acanthosis nigricans, in particular, has been documented to lighten and reduce in extent as insulin levels normalize with lifestyle intervention and weight loss where applicable. The appearance of the skin is not just an aesthetic concern. It is a real-time metabolic readout, a biological dashboard that reflects the interior chemistry of the body with more immediacy and accessibility than any laboratory test. And once you know how to read it, you cannot unsee what you are seeing. Tell me in the comments whether you recognized any of these signs on your own skin or on the skin of someone you love, and whether this is the first time the connection to blood sugar has been made clear. Your experience here matters enormously because the person who is going to read your comment tomorrow may be carrying the same signals without any framework to understand them. And please share this video with the people in your life who are over 60, because the earlier the blood sugar story is identified, the more of the story can still be changed. The skin has been speaking all along. Now you know the language. What the mirror shows is more than you thought it was. Start looking with new eyes.